So vulvovaginal atrophy is a condition that women unfortunately get after the menopause commonly, and it's due to estrogen deficiency. And it's a condition which is mainly directed towards the skin of the vulva and also the vagina. So the skin on the outside and the skin inside. And the condition is commonly associated with thinning of the skin. The skin becomes very fragile, and the effect of this is that women find a lot of discomfort and soreness and dryness as a consequence of this condition. Now, estrogen in a woman's body is very important. It affects many organs in a woman's body. So not only the skin, but it also affects the muscles, particularly in the pelvic floor. Certain organs like the bladder impacted upon estrogen deficiency or low levels of estrogen. And also the brain function in a woman is affected by estrogen. So women often talk about something called brain fog, or their thought processes are not particularly clear when they've passed through the menopause. And so as a consequence of this complete syndrome, which affects multi-organs, particularly looking in relation to things like the bones, we now have this condition called genitourinary syndrome of the menopause. So vulvovaginal atrophy is actually a rather older term specific for the skin changes in the genital area, but actually we now mainly talk about genitourinary syndrome of the menopause. And it's all caused by this lack of estrogen. Nearly every woman after the menopause will experience some symptoms relating to this condition. And it's only if they're on specific treatment to correct it that they will avoid these conditions. And sadly, many women feel that this condition is a natural part of aging. So the vaginal dryness, which is common after menopause, many women think this is the norm and this is the way they need to live their lives. But in actual fact, there is very effective treatments for this, and this is entirely avoidable. And now there's a lot of information available on the internet and so forth and social media, which is actually giving women awareness that this condition is entirely avoidable. So the main symptom of genitourinary syndrome of the menopause is the vaginal dryness. And this has an impact on sexual function. It has an impact on normal activities like sport or other sort of activities. It can affect the bladder function. So women often say that their bladder function deteriorates after the menopause. So increased problems with continence, increased problems of urgency, and they often complain of abnormal discharge from the vagina. And this again is due to imbalance of the bacteria within the vagina as a direct consequence of the thinning of the skin of the vagina and the normal function of the vaginal mucosa or skin. So it's low levels of estrogen. So the low levels of estrogen in these tissues which are sensitive to the effects of estrogen become thinned, and the normal growth of the skin of the vagina or the mucosa of the vagina becomes very much diminished. And so the estrogen stimulation, which is required to cause the skin to keep growing and keep thick and healthy, and producing the cells which the normal bacteria in the vagina require, becomes very much diminished. And by replacing that estrogen, you can completely normalize these changes. And the vagina will become more elastic and thus much more accommodating to sexual function. And problems such as bleeding, which is common with this condition, can completely be eradicated. And it can really transform the lives of women by just replacing the estrogen. So we've got simple non-hormonal treatments. So you can just treat the symptoms. So you can put in sort of vaginal moisturizers, vaginal lubricants, and that will treat the symptom, but it's not actually treating the underlying problem. And the underlying problem is the lack of estrogen. And for most women, taking estrogen is safe. And you can take estrogen either topically on the area that's affected. So you can put creams in the vagina or on the vulval skin, or you can put tablets in the vagina, which release the hormone that's required. These are perfectly safe for the majority of women. For some women who have other symptoms of the menopause, then having systemic treatment or whole body treatment in the form of either tablets or creams is another alternative. And there's various combinations that can be given depending on whether or not a woman has had a hysterectomy or still retains her womb. And so in summary, estrogen replacement is the standard treatment for this condition. However, there are some women that cannot have estrogen replacement because they've had other conditions in the past which prevent them from having it. And so women such as women that have breast cancer, those women may have a cancer which is sensitive to the effects of estrogen. And by replacing the estrogen, you may increase the risk of their cancer coming back. And in that group of women, they can either have the conservative treatments with just lubricants and moisturizers, or they can consider other treatments such as Mona Lisa touch laser therapy. Now, this laser therapy is the only laser which is currently certified for the treatment of this condition. And the laser works non-hormonally, and it creates a reaction to the laser energy which mimics the effects of estrogen. It's very interesting because it actually restores the vagina as if it had estrogen treatment. And this laser treatment has transformed the lives of many women who have had conditions like breast cancer, which have been very debilitating, and returned their function back to normal. So the laser is the new kid on the block, so to speak, and really transforming the lives of these women.